Gentlemen, if you're watching this video, you've likely experienced that moment, that frustrating moment, when things are moving too fast and you can't seem to slow down or maintain control the way you used to. Maybe your wife notices. Maybe she doesn't say anything, but you see it in her eyes. The disappointment, the understanding that tries to hide the sadness, and it breaks your heart because you remember when things were different, when you could take your time, when you could focus on her pleasure, when the passion between you lasted as long as you both wanted it to. I'm Dr. Shalene Jomas, and for over 2 decades as a urologist specializing in men's intimate health, I've sat across from thousands of men just like you, good men, devoted husbands in their 60s, 70s, and early 80s, who thought their best days were behind them, men who believed that age had stolen something precious from their marriage. But here's what I've discovered in my years of practice. It doesn't have to be this way. There's a natural breathing technique that's helped my patients reclaim stamina, control, and confidence in the bedroom without pills, without side effects, and without that clinical, scheduled feeling that comes with pharmaceutical solutions. In fact, I had a 68-year-old patient, let's call him Robert, who came to me 6 months ago, absolutely defeated. He'd been married 42 years to his high school sweetheart, and he told me with tears in his eyes that he felt like he was failing her. Lasting barely 3 to 4 minutes had become his new normal. But after I taught him this exact breathing method I'm about to share with you today, he came back 5 weeks later with a completely different energy. He pulled me aside and whispered, "Doc, last weekend we celebrated our anniversary, and for the first time in years, I lasted over 30 minutes. I saw that look in her eyes again, the one from when we were young." That's the power of what I'm sharing with you today, gentlemen, and I'm sharing it discreetly, respectfully, because I know this topic isn't easy to discuss. But your marriage, your connection with your wife, your confidence as a man, these things matter. So let's talk about this like grown men who deserve answers. The reality of what's happening in your body. First, let me explain what's actually happening physiologically as we age. When you're in your 60s, 70s, or 80s, your body has gone through natural changes. I want you to understand this isn't about failure. It's about biology. But here's the important part. Biology can be worked with, trained, and improved, even at your age. As we get older, several things happen simultaneously. The pelvic floor muscles, the same muscles that control urination and intimate function, naturally weaken. Think of them like any other muscle group. Without targeted training, they atrophy. These muscles are responsible for control, for the ability to pause, to slow down, to extend intimate moments. When they weaken, you lose that control. Simultaneously, your nervous system becomes more reactive. The sympathetic nervous system, your fight or flight response, starts to dominate during intimate moments. This creates a hair trigger response. Your body, sensing arousal and stimulation, rushes toward completion as if it's in an emergency situation. This is the opposite of what you want. You want your parasympathetic nervous system, your rest and digest mode, to be active during intimacy. This is the mode that allows for relaxation, extended pleasure, and true connection with your wife. I've had countless men in my office describe this frustration to me. One patient, 72 years old, married 48 years, told me, "Doctor, I feel like I'm disappointing the woman I love most in this world. She never complains, but I know she misses the intimacy we used to share. I want to give her that again. I want to take my time with her, to make her feel cherished the way she deserves." This emotional component is what drives me to help men like you, because this isn't just about physical function. It's about preserving the sacred bond of marriage, about honoring your wife with attention and care in the most intimate setting. When you can last longer, when you can control the pace and rhythm, you're telling your wife with your body that she matters, that her pleasure is important, that you're still the man she fell in love with. The impact on marriage is profound, gentlemen. When intimate difficulties persist, couples stop trying. They avoid physical connection because the disappointment is too painful. The bedroom becomes a source of anxiety rather than joy. I've seen marriages of 40, 50 years quietly deteriorate because this one aspect, which should bring joy and connection, instead brings shame and distance. But here's the truth that keeps me passionate about this work. This decline is not inevitable. The right technique, practiced consistently, can reverse these changes. You can retrain your nervous system. You can strengthen your pelvic floor muscles. You can bring back the control, the stamina, and the confidence that make intimate moments meaningful again. Why pharmaceutical solutions fall short. Now I know many of you have tried Viagra, Cialis, or similar medications, and I'm not here to tell you these medications don't serve a purpose. They do, particularly for men dealing with specific blood flow issues. But let me be honest with you about their limitations, because this is information you deserve to know. These medications do one thing. They increase blood flow to create and maintain firmness. That's it. They don't give you control. They don't help you last longer. They don't address the underlying nervous system reactivity or the weak pelvic floor muscles that are causing premature conclusion. In fact, I've had patients tell me that these medications sometimes make the problem worse. Increased sensitivity without increased control creates an even more frustrating situation. Let me share what one of my patients, 65-year-old Thomas, experienced. He'd been taking medication for 2 years, spending over $400 per month on pills. He said, "Doc, I can achieve firmness, but I still finish within 5 minutes. My wife and I are intimate maybe twice a month because the pills work, but the experience is the same, quick and unsatisfying for both of us. I'm spending all this money and still feeling like I'm failing her." Beyond the lack of control benefits, these medications come with side effects many men don't anticipate. Headaches, flushing, digestive issues, vision changes, and that stuffy nose that makes intimate moments less romantic than you'd hope. Some men experience anxiety about timing. You need to take the pill 30 to 60 minutes before intimacy, which means intimate moments become scheduled, clinical, and spontaneous. Passion becomes impossible. There's also the psychological component. Depending on a pill can actually increase performance anxiety. You worry, what if it doesn't work tonight? What if I forgot to take it? What if the side effects are bad this time? This anxiety activates that same sympathetic nervous system we talked about earlier, the exact system that's causing rapid completion in the first place. It becomes a vicious cycle. The supplements marketed for men's intimate health are another area where I see men wasting money and hope. Walk into any pharmacy and you'll see dozens of natural male enhancement products with bold promises. Most of these contain ingredients like L-arginine, ginseng, or various herbs. While some of these ingredients have mild effects on blood flow, none of them address the core issue: nervous system control and pelvic floor strength. I want you to invest your time and energy in something that creates lasting change, something that works with your body's natural systems, something that doesn't require you to spend hundreds of dollars per month or schedule intimate moments around medication timing. That's where this breathing technique comes in, the natural solution your body has been waiting for. Gentlemen, what I'm about to share with you is a method that's been studied in Eastern medicine for centuries and has recently gained attention in Western urology and sexual health research. It's based on a simple but profound principle. Your breath directly controls your nervous system, and your nervous system controls your intimate response. This technique is called the modified 4-7-8 intimate breathing pattern, and I've adapted it specifically for men dealing with premature completion and stamina issues. Over my 2 decades of practice, I've refined this method based on what works consistently for men in their 60s, 70s, and 80s. Here's what makes this method so powerful. By controlling your breath in a specific pattern during intimate moments, you activate your parasympathetic nervous system, that rest and relax mode I mentioned earlier. This literally sends signals to your brain and body to slow down, to extend arousal, to maintain control. At the same time, You're engaging your pelvic floor muscles in a way that strengthens them over time, giving you the physical control that's been weakening with age. The technique has 3 components working together: conscious breathing that calms your nervous system, strategic muscle engagement that strengthens your pelvic floor, and mental focus that redirects your attention away from the urgent, rushing sensation toward sustained, connected intimacy. I developed this specific adaptation after watching patient after patient struggle with generic advice. Standard pelvic floor exercises done at a doctor's office desk don't translate to the real, vulnerable, emotionally charged moment of intimacy with your wife. You need something practical, something you can actually do in the moment when it matters most. One of my patients, 74-year-old David, described his experience after learning this method. "Dr. Jomas, the first night I tried it, I was skeptical. But I followed your instructions exactly as you taught me. Within minutes, I felt this sense of control I hadn't experienced in years. I could feel the building sensation, but instead of being overwhelmed by it, I could manage it. We were intimate for nearly 20 minutes that first night. My wife actually asked me what had changed. The look of joy on her face. That's what this is really about." The science behind why this works. Let me explain the science behind this technique so you understand exactly why it's so effective. Understanding the mechanism helps you trust the process and commit to the practice. Your autonomic nervous system has 2 branches, sympathetic and parasympathetic. Think of the sympathetic system as a gas pedal. It accelerates everything, including intimate response. The parasympathetic system is your brake pedal. Most men experiencing premature completion are stuck with their foot on the gas. This breathing pattern literally moves your foot to the brake. When you breathe in a shallow, rapid pattern, which is what most men do unconsciously during intimacy, especially when they're anxious about performance, you're activating sympathetic responses. Your heart rate increases, blood pressure rises, stress hormones like cortisol and adrenaline flood your system, and your body interprets the situation as urgent. This urgency triggers rapid progression toward completion. But when you breathe slowly, deeply, and in a controlled rhythm, something remarkable happens. You activate the vagus nerve, the longest nerve in your body that runs from your brain down through your chest and abdomen. The vagus nerve is the master controller of your parasympathetic system. Slow, deep breathing stimulates the vagus nerve, which sends calming signals throughout your body. Research in neuroscience has shown that controlled breathing patterns can reduce cortisol levels by up to 40% within minutes. This reduction in stress hormones directly translates to better intimate control. Your body literally interprets the slow breathing as a signal that everything is safe, that there's no rush, that you can take your time. Now let's talk about the pelvic floor component. Your pelvic floor muscles form a hammock-like structure at the base of your pelvis. These muscles support bladder control, bowel function, and critically for our purposes, intimate function. During climax, these muscles contract involuntarily, but here's the key insight. You can train these muscles to resist that involuntary contraction, giving you conscious control over timing. Think of it like this. Imagine you're at the point where you need to urinate urgently, but you need to wait a few minutes. You engage certain muscles, those are your pelvic floor muscles, to maintain control. The same muscles control intimate response. By strengthening them and learning to consciously engage them during intimate moments, you can literally pause or delay completion. The breathing pattern I teach you works synergistically with pelvic floor engagement. When you breathe out slowly, your pelvic floor naturally relaxes slightly. When you hold your breath briefly, you can engage those muscles with precision. This creates a rhythm. Breathe in, engage muscles, hold. Breathe out slowly while releasing. This rhythm gives you unprecedented control. There's also a hormonal component that's fascinating. During intimate moments, your body releases dopamine, the pleasure and motivation hormone, and oxytocin, the bonding and connection hormone. Quick, rushed intimacy creates a dopamine spike followed by a crash, which can leave both you and your wife feeling unfulfilled. Extended intimacy with controlled breathing maintains steady dopamine and increases oxytocin release, creating deeper emotional bonding with your wife and more satisfying experiences for you both. Research from the Journal of Sexual Medicine has shown that men who practice controlled breathing and pelvic floor exercises together report an average increase of 230% in duration before completion. That means if you're currently lasting 4 minutes with consistent practice, you could be lasting over 9 minutes within weeks, and many men reach 15, 20, or even 30 minutes with continued practice. The technique also addresses sensitivity issues. Many older men experience heightened sensitivity that contributes to premature completion. The breathing pattern and muscle engagement create what researchers call sensory gating. Essentially, you're training your brain to process sensation differently, to not interpret every sensation as a signal to rush toward completion. Step-by-step instructions for immediate implementation. All right, gentlemen, let's get practical. Here's exactly how to implement the modified 4-7-8 intimate breathing pattern. I recommend you practice this twice daily for 1 week before using it during intimacy, just to make the pattern automatic. First, find a quiet space where you can sit comfortably. Place one hand on your chest and one hand on your lower abdomen, just above your navel. This helps you monitor your breathing pattern. Here's the basic pattern. Breathe in slowly through your nose for a count of 4 seconds. Feel your lower abdomen expand. This is diaphragmatic breathing, not shallow chest breathing. As you breathe in, gently engage your pelvic floor muscles. To identify these muscles, imagine you're stopping urination midstream or preventing passing gas. That's the sensation. Hold your breath for 7 seconds while maintaining that pelvic floor engagement. This hold time is crucial. It's what activates the vagus nerve most effectively. Then, breathe out slowly through your mouth for 8 seconds, making a soft, whooshing sound as you release. As you exhale, consciously relax your pelvic floor muscles. This complete cycle is 1 repetition. Practice this pattern for 5 repetitions, twice a day, once in the morning and once before bed. After 1 week of daily practice, your body will remember this pattern automatically, and you can implement it during intimate moments. During intimacy with your wife, here's how to apply it. As you begin to feel increased arousal and that familiar building sensation that usually precedes rapid completion, immediately start the breathing pattern. 4 seconds in, 7-second hold with muscle engagement, 8 seconds out with muscle release. Continue this pattern throughout the intimate experience. Common mistakes to avoid. Don't hold your breath in a tense, straining way. The hold should feel controlled, but not forced. Don't forget to actually relax your pelvic floor on the exhale. Many men keep clenching throughout, which defeats the purpose. And don't breathe too rapidly, trying to rush through the counts. The slowness is what creates the effect. Advanced tip. Once you're comfortable with the basic pattern, you can adjust the timing slightly based on your arousal level. If you feel very close to completion, extend the hold to 9 seconds and the exhale to 10 seconds. This gives you even more control in critical moments. What to expect? Your timeline to transformation. Let me be realistic with you about timelines, because I believe in setting honest expectations. This isn't a miracle cure that transforms everything overnight, but it is a legitimate, scientifically backed method that produces measurable results when practiced consistently. Night 1. The first time you use this breathing pattern during intimacy, most men report an immediate sense of better control. You won't necessarily last dramatically longer the very first time, but you'll feel that you can manage sensation, that you're not completely at the mercy of your body's automatic response. Many patients tell me they lasted 50-75% longer than usual on that first attempt, week 1 through 2. This is where real change begins. Your pelvic floor muscles are starting to strengthen from the daily practice. Your nervous system is learning the new pattern. Most men report consistently lasting 2 to 3 times longer than before starting the technique. If you were typically lasting 3 to 4 minutes, you're now reaching 8 to 12 minutes consistently. Week 3 through 4. This is the transformation point. By now, the breathing pattern has become second nature. You're not thinking about technique during intimate moments. Your body just does it automatically. Your pelvic floor muscles are noticeably stronger. Men typically report lasting 15 to 25 minutes, with full control over pacing and timing. Several patients have told me this is when their wives started initiating intimacy more frequently, sensing the renewed confidence and capability. Month 2 and beyond. At this point, you've fundamentally retrained your intimate response. 30-minute sessions become normal. You can focus entirely on your wife's pleasure, taking your time, varying pace and intensity at will. The psychological burden of performance anxiety has lifted. One 78-year-old patient told me, "Doc, my wife and I are like newlyweds again. We're intimate 2 to 3 times a week, and every time is unhurried and beautiful. I didn't think this was possible at my age." The beauty of this method is that the benefits compound over time. Unlike pills that stop working the moment you stop taking them, the strength and control you build through this breathing technique become permanent parts of your intimate capability. You're literally rewiring your nervous system and rebuilding your pelvic floor. Additional natural strategies for complete intimate health. While the breathing technique is the core of what I teach, let me share a few additional natural strategies that amplify your results and support overall intimate health. First, consider your diet in the hours before intimacy. Heavy, greasy meals divert blood flow to your digestive system, away from where you need it for optimal intimate function. On days when you anticipate intimate time with your wife, eat lighter meals with lean protein and vegetables. Foods rich in L-arginine, like spinach, nuts, and lean chicken, naturally support blood flow. Second, stay properly hydrated. Dehydration thickens your blood slightly, reducing optimal circulation. I recommend my patients drink at least 64 ounces of water daily, and specifically 8 ounces about 2 hours before anticipated intimacy. Third, temperature matters more than most men realize. Your body functions optimally at slightly cooler temperatures. If your bedroom is overheated, it can accelerate your response time. Keep your bedroom temperature around 65 to 68 degrees Fahrenheit for optimal intimate performance. Here's what to avoid. Alcohol, even in moderate amounts, impairs the precise nervous system control you're developing. I tell my patients to avoid alcohol for at least 4 hours before intimacy. Marijuana and other substances similarly disrupt the breathing nervous system connection this technique relies on. Also avoid vigorous exercise within 3 hours of intimate time. While regular exercise is excellent for overall intimate health, intense exercise immediately before intimacy leaves you physically and neurologically fatigued, working against the control you're trying to maintain. On-screen text. Warning. Always consult your physician before trying new techniques. Your marriage deserves this investment. Gentlemen, we've covered a lot of ground today, but let me bring this back to what really matters. This isn't about performance for performance's sake. This isn't about ego or comparison or trying to be something you're not. This is about honoring your marriage, about giving your wife the gift of your full, present, unhurried attention in your most intimate moments together. I've seen marriages transform when men implement this breathing technique. I've seen couples in their 70s rediscover passion they thought was gone forever. I've seen wives tear up with joy when their husbands last long enough to truly connect, to make them feel desired and cherished. That's what drives my work. That's why I'm sharing this with you today. The modified 4 to 7-8. Intimate breathing pattern. Breathe in for 4 seconds while engaging your pelvic floor. Hold for 7 seconds. Breathe out for 8 seconds while relaxing. Practice this twice daily. Use it during intimate moments. Give it 4 weeks of consistent practice. Starting tonight, you can begin implementing this. Practice the breathing pattern before bed. Share with your wife that you're working on improving your intimate connection with her. Most wives are incredibly supportive when they know their husbands are making this effort. If this video has given you hope, if you're ready to try this natural method and bring back the passion in your marriage, I want to hear from you. Leave a comment below saying, "I'm trying this for her." Let's build a community of men committed to honoring their wives and their marriages. Hit the like button so other men can find this information. And subscribe to this channel because I'll be sharing more natural techniques for men's health that your doctor probably isn't discussing with you. Remember, gentlemen, age is just a number. Your best intimate years can still be ahead of you. You have the power to change this. Your wife is worth the effort. Your marriage is worth the investment. I'm Dr. Chalene Jomas, and I'm honored to be part of your journey back to confident, connected, lasting intimacy.